Hi guys, I'm Bhasha Mukherjee, your Miss England 2019, and I just want to have a quick chat with you guys because a lot of people have been asking me what my Beauty with a Purpose is this year for Miss World, and it is diabetes and health awareness for diabetes. Now, a lot of people are asking me, why have you chosen health awareness for diabetes in particular? Now, as you know, and if you don't know, here's me telling you, my job is a doctor. So I'm a doctor, which means I cure people. That is my job, and that's what my job is going to be for the next 40 years. Now, as a doctor, you're fixing a problem that's already a problem. And although the focus is to educate people and to tell them preventative measures to look after their health, in the NHS, it's not much of a possibility within a 10-minute slot with a patient among all our other jobs and among so many patients to really dedicate a good amount of time to just talking about prevention. And we really don't have the reach, and majority of the patients that come to hospitals are already very ill. And what about all the well people out there? What about all the people that are young and they haven't developed those health problems yet? We're not reaching out to them. Now, I have a voice now. I have a position. I have followers. Not that many. Not as many as the likes of Kim Kardashian and everybody else. But even if I reach out to one person, they will listen, possibly, if they are following me. And I felt that it's my duty, with my new voice and my new status, my new platform, to push the aspect that's going to prevent the problem that I fix. Push the prevention. Prevention is better than cure. And that's what I'd like to focus my entire 50% of my time when I'm not in hospitals trying to cure people. I'm focusing on my campaign this year on prevention. And the way I feel that is going to be best possible is to target young people, because that is when health behaviors are formed, and that is when we need to target the information, because the information, the life choices they make at that age is going to last them their lifetime. Why I've chosen diabetes? Because it's simply something that is not talked about enough. Everyone knows about cancer and everyone is petrified of cancer. Why do we not talk about diabetes when really it's the top cause for things like heart disease, things like high blood pressure, strokes, kidney problems, people losing their limbs, disabilities, eye problems, everything, almost everything that is preventable in the first world and the third world these days actually goes back to diabetes. Globally, we are actually fighting diabetes not just in the third world among all these other tropical diseases, but actually we're also tackling a very first world problem like diabetes. And that's why I thought this is a great one to talk about, because not only is it so prevalent, so many people have it for genetic reasons. South Asians, the black community, we are genetically predisposed, and most of us don't even know this, that our risk is so high. And the Western population, America, UK, Europe, we're all suffering obesity crisis, and obesity is directly linked with type 2 diabetes. And the beauty of diabetes is that as damaging as it is very much preventable. And this is why the prevention and awareness is so necessary for this particular disease. Because if we can prevent diabetes, if we can prevent obesity in the West and the East with just simple awareness, then we can actually cut down a lot of health costs. And if you just imagine just the number of patients we can cut down, a number of costs we can cut down, all that money that we save from not having to treat as many people with diabetes, all that money is now saved for other research, for other diseases that we don't have all the money for. For example, antibiotics. antibiotics are slowly getting extinct because of antibiotic resistance. We need more research into that field. We need more research into cancer. We need more research into diseases that we are still not on top of. With just prevention of diabetes, with just awareness of diabetes and obesity and everything that's linked with it, we can change that. And that is why I'm focusing on that. Because I believe a doctor's role is not just to fix a problem, but stop the problem from happening in the first place. And that's why prevention is bigger than cure. And with my 1 year as Miss England, I'm going to try to do that. Because this is the only time when people will be listening to me. Maybe in the future they will. But here's the time where I can really utilize my position among young people to really get them to listen. And maybe spread the word as well. Thank you for listening, guys. Mwah.